There's one observation I would make at the start. I used to work for a congressman. I've probably attended hundreds of town hall meetings as both a congressional staffer and certainly at FreedomWorks, and there are three types of people that show up at town hall meetings. This is an ironclad rule. Crazy people show up, special interests show up, and real citizens show up. What's remarkable about what's gone on in the August recess is the amazing, overwhelming attendance of real citizens that have shown up and literally overwhelmed the infrastructure of town hall meetings. This is something that President Obama and Nancy Pelosi and most of the Democratic establishment has completely misread. They were caught so flat-footed on this, and to this day they continue to make fun of these people. And I don't know very many political parties that have successfully won elections by making fun of their constituents, but that appears to be their strategy on this. A couple examples, I mean, Nancy Pelosi famously called them un-American, and it's kind of weird. She also continues to insist that they're fake. If you're not real, I suppose you can't be American or un-American, you're simply fake. So there's a lot of contradictions there. President Obama in a town hall meeting the other day had a lot of fun at senior citizens' expense, mocking seniors that had shown up at town hall meetings, yelling, "Keep your hands off my Medicare." Well, he points out, as we all know, that Medicare is a government program, and that fact has nothing to do with what they were talking about. What they were talking about was the idea that a government program that they depend on, that they didn't have a choice as to whether or not they were going to get their health care from Medicare, which is $47 trillion in debt and growing, that the Democrats have proposed taking $500 billion out of that broken program to add more people into government-run health care. Now that to me sounds kind of crazy, but more importantly, these seniors think it's crazy. And the only response they've had so far has been to insult them. So as opposed to responding to these real citizens that are showing up at these town hall meetings, they are attacking them.
FreedomWorks issued an apology to the left. Why did you do that?
Well, we got some pretty hostile calls from some union folks and some Move On activists, and we thought instead of just being upset about it, we could have some fun with it, but also to point out that if we're throwing accusations of hostile rhetoric or coarseness around, that people should actually see what the left is saying about the citizens that are showing up at town hall meetings.
With regard to a public option, there seems to be a lot of back and forth with the Obama administration. Where do you see that going right now?
Well, I think right today they're back on board with the public option. Tomorrow they may be leaning the other way again. I think it's important to understand that this battle isn't just about the public option. The health care bill is this massive multi-thousand-page bill that has a lot of bad ideas in it that would distort healthcare markets and make it more expensive for people to get health care, such as an individual mandate, a mandated benefits package, community rating. All of these things make it more expensive and more difficult for the uninsured to get insurance.
What do you think is the reason that the citizens have become so outraged at what's been going on and exercising their rights through the town halls?
Yeah, well, there's two things going on here. One is about the process, and you could even go back to last fall when President Bush, then Senator Obama, and the Democratic leadership in Congress rushed through the TARP legislation, the bailout of the big banks. It was not a transparent process. And the day after the bill, and to this day, that legislation is doing things that no one at the time either understood or clearly expressed. Fast forward to the stimulus package, which was a legislative panic, it was a poorly written bill. Nobody knew it was in the bill. It was passed so quickly that the American public didn't have a chance to review what was in it. And right after the passage of the stimulus bill, the Democratic chairman of the Committee of Jurisdiction said, of his own provision, I don't know, I didn't even know that was in there. So when the president came out on health care and announced that we are going to get this done by the August recess, I think the American people said, wait a minute, what's going on? We don't want this to happen again. This is an important issue to us. Our health care is not something to be trifled with by bad legislation, last-minute deals, secret deals with the insurance industry. We got to show up. And then when they started showing up, they started reading the bill. And it turns out they don't like it. So it's a combination of process and the very idea that more government involvement in healthcare is going to improve healthcare for real people. It's just not true.